That's interesting. So, and it's such a small number, right? 3% is
It
so
is.
manageable.
I'll paraphrase Ralph Waldo Emerson. It says, you cannot possibly help another person without helping yourself first.
Let's go more into depth about the program that you developed. So, like, pretty much you developed this program at Michigan, and then you took it over to UCLA, right? So, what is the program that you're talking about? Like, let's go into some specifics here.
Okay, so number one, it's the mission statement is enhancing our students' education while increasing access to care accountably and sustainably.
Okay.
So what we're trying to do is open our students' eyes to all practice opportunities before they graduate. And this experience allows them to do self-assessment on a platform of 13 clinical markers to see what they need to do after graduation to become more proficient in their profession. And I have to tell you, it's a great resource because it becomes a working interview in a lot of cases for our students. Many of our students get hired while they're on rotation. But number one is I try to look at opportunities that give back to patients that struggle with access to care, be it from a demographic standpoint, a financial standpoint, whatever their social determinants of health that preclude them from getting care. We try to target those locations and try to make clinics that are providing that type of care more whole. And so I started investigating different things. So public health clinics, then we had private practices that gave back to the communities. Then we had private practices that started 501(c) philanthropic practices to give back to the communities. Those are the true champions, if you will. And we found out that champions really do engage in community service, and what they love is accountability. So ergo, we measured everything from everything that our students did, and they truly enjoyed that. And many of our partners actually won awards from the American Dental Association for participation in these community service programs. So we're trying to let our students learn from the very best and brightest in the business and to create different opportunities. So in Michigan, I had private practices, I had tribal clinics, I had public health clinics that were state, local, or federally funded. We had private practices that created their own 501(c). We developed our own philanthropic organizations with Victors for Veterans, Victor's Open Arms, Wolverine Patriot Program, and now Bruin Smiles is another one we're now working on in the California market. So we're creating our practices and we're allowing our students to develop these unique platforms and to understand what it truly means to become a healthcare professional. Because I contend that if someone gave back 3% of their time, money, or energy, we would not have a crisis in delivering healthcare.
Yeah, that's interesting. So, and it's such a small number, right? 3% is
It
so
is.
manageable. So,
but I have to tell you, I'll paraphrase Ralph Waldo Emerson. It says, you cannot possibly help another person without helping yourself first.